doing it with creating more government, more bureaucracy, and more cost for the American taxpayer. And we look forward to sharing those ideas with you. We want to work with you on health reform and making certain that we do it in an affordable, cost-effective way.
Now, you may not agree with Bob Dole and Howard Baker, and certainly you don't agree with Tom Daschle on much, but that's not a radical bunch. But if you were to listen to the debate, and frankly how some of you went after this bill, you'd think that this thing was some Bolshevik plot. No, I mean, that's how you guys presented it.
Marsha Blackburn walked into that room expecting to drop a viral healthcare hit piece on Barack Obama, but she walked out getting a free masterclass in her own party's policy history, leaving the room so quiet you could hear a bug wearing bedroom slippers. By the time Obama finished dissecting her talking points line by line, even her fellow Republicans were sitting there clapping for the guy they claimed was trying to destroy America. Look, I know we're all completely exhausted by the constant right-wing circus, but rewatching this clip, it is pure, unadulterated catharsis. Because for once, we got to see a progressive leader sit right across from these corporate-backed, out-of-touch politicians and just completely dismantle their bad faith nonsense to their faces. Let's break down what actually happened here.
Marsha Blackburn, Tennessee.
Hey.
Thank you, Mr. President, and thank you for acknowledging that we have ideas on health care, because indeed we do have ideas, we have plans, we have over 50 bills, we have lots of amendments that would bring health care ideas to the forefront. We've got plans to lower costs, to change purchasing models, address medical liability, insurance accountability, chronic and pre-existing conditions, and access to affordable care for those with those conditions. Insurance portability, expanded access, but not doing it with creating more government, more bureaucracy, and more cost for the American taxpayer. And we look forward to sharing those ideas with you. We want to work with you on health reform and making certain that we do it in an affordable, cost-effective way that is going to reduce bureaucracy, reduce government interference, and reduce costs to individuals and to taxpayers. And if those good ideas aren't making it to you, maybe it's the House Democrat leadership that is an impediment instead of a conduit.
Right.
But we're concerned also that there are some lessons learned from public option health care plans that maybe are not being heeded. And certainly in my state of Tennessee, we were the test case for public option health care in 1994. And our Democrat government has even cautioned that maybe our experiences there would provide some lessons learned that should be heeded and would provide guidance for us to go forward. And as you said, what we should be doing is tossing old ideas out, bad ideas out, and moving forward and refining good ideas. And certainly we would welcome that opportunity. So my question to you is, when will we look forward to starting anew and sitting down with you to put all of these ideas on the table, to look at these lessons learned, to benefit from that experience, and to produce a product that is going to reduce government interference, reduce costs, and be fair to the American taxpayer?
Actually, I've gotten many of your ideas. I've taken a look at them, even before I was handed this. Some of the ideas we have embraced and are in our package. Some of them are embraced with caveats. So let me give you an example. I think one of the proposals that has been focused on by the Republicans as a way to reduce costs is allowing insurance companies to sell across state lines. We actually include that as part of our approach. But the caveat is, we've got to do so with some minimum standards, because otherwise what happens is that you could have insurance companies circumvent a whole bunch of state regulations about, basic benefits or what have you, making sure that a woman is able to get mammograms as part of preventive care, for example. Part of what could happen is insurance companies could go into states and cherry pick and just get those who are healthiest and leave behind those who are least healthy, which would raise everybody's premiums who weren't healthy, right? So it's not that many of these ideas aren't workable, but we have to refine them to make sure that they don't just end up worsening the situation for folks rather than making it better. Now, what I said at the State of the Union is what I still believe. If you can show me, and if I get confirmation from healthcare experts, people who know the system and how it works, including doctors and nurses, ways of reducing people's premiums, covering those who do not have insurance, making it more affordable for small businesses, having insurance reforms that ensure people have insurance even when they've got pre-existing conditions, that their coverage is not dropped just because they're sick, that young people right out of college or as they're entering into the workforce can still get health insurance. If those component parts are things that you care about and want to do, I'm game. And I've got I've got a lot of these ideas. The last thing I will say, though, let me say this about healthcare and the healthcare debate, because I think it also bears on a whole lot of other issues. If you look at the package that we've presented, and there's some stray cats and dogs that got in there that we were eliminating. We were in the process of eliminating. For example, we said from the start that it was going to be important for us to be consistent in saying to people, if you can have if you want to keep the health insurance you got, you can keep it. That you're not going to have anybody getting in between you and your doctor in your decision making. And I think that some of the provisions that got snuck in might have violated that pledge. And so we're in the process of scrubbing this and making sure that it's tight. But at its core, if you look at the basic proposal that we put forward, that has an exchange so that businesses and the self-employed can buy into a pool and can get bargaining power the same way big companies do, the insurance reforms that I've already discussed, making sure that there's choice and competition for those who don't have health insurance. The component parts of this thing are pretty similar to what Howard Baker, Bob Dole, and Tom Daschle proposed at the beginning of this debate last year. Now, you may not agree with Bob Dole and Howard Baker, and certainly you don't agree with Tom Daschle on much, but that's not a radical bunch. But if you were to listen to the debate, and frankly how some of you went after this bill, you'd think that this thing was some Bolshevik plot. No, I mean, that's how you guys presented it. And so I'm thinking to myself, well, how is it that a plan that is pretty centrist, no, look, I mean, I'm just saying, I know you guys disagree, but if you look at the facts of this bill, most independent observers would say this is actually what many Republicans, it is similar to what many Republicans proposed to Bill Clinton when he was doing his debate on health care. So All I'm saying is we've got to close the gap a little bit between the rhetoric and the reality. I'm not suggesting that we're going to agree on everything, whether it's on health care or energy or what have you. But if the way these issues are being presented by the Republicans is that this is some wild-eyed plot to impose huge government in every aspect of our lives, what happens is you guys then don't have a lot of room to negotiate with me. I mean, the fact of the matter is that many of you, if you voted with the administration on something, are politically vulnerable in your own base, in your own party. You've given yourselves very little room to work in a bipartisan fashion because what you've been telling your constituents is, this guy's doing all kinds of crazy stuff that's going to destroy America. And I would just say that we have to think about tone. It's not just on your side, by the way. It's on our side as well. This is part of what's happened in our politics, where we demonize the other side so much that when it comes to actually getting things done, it becomes tough to do.
So Marsha Blackburn stands up, right? And she gets this smirking, patronizing tone, you know the exact look I'm talking about, and claims Republicans have over 50 health care bills just waiting. But Democrats are ignoring market-based solutions. Wait, are they kidding me? 50 bills? Where were those bills when they had full control of Congress? Exactly. Nowhere. But watch what Obama does. He doesn't dodge. He looks at her and basically says, actually, Marsha, I've read your proposals. I've incorporated several of them. And then he brings up their absolute favorite golden child slogan, selling insurance across state lines. And this is where he exposes the entire scam. He explains that if you let insurance companies do whatever they want across state lines without federal regulations, they're just going to set up shop in whichever state lets them screw over workers the most. They'll cherry pick healthy people, abandon anyone with pre-existing conditions, and hike costs for everybody else. He literally took their shiny little bumper sticker line and showed everyone the toxic junk hiding underneath it. And then Obama lays out what actual humane policy is supposed to do. Does a plan lower your premiums? Does it cover pre-existing conditions? Does it stop insurance executives from literally cutting off your coverage the minute you get sick? Yes. That is what healthcare as a human right looks like. That's what we should be fighting for every single day. But then he does something so rare for a politician. He openly admits early drafts of the Democratic bill had extra bloat in it. He called them stray cats and dogs and said they were scrubbing it out so people could keep their doctors without useless bureaucracy. Unbelievable. A leader actually taking responsibility and trimming the fat instead of just blindly defending corporate lobbying. Compare that to the right wing, where every single terrible bill they push is wrapped in a flag and forced down our throats. Okay, this next part is where my brain completely melted. Obama reminds the whole room that the core mechanics of the ACA, like public health exchanges, weren't some radical left-wing takeover. They were literally designed by Republicans back in the 90s. Figures like Bob Dole and Howard Baker championed them. So Obama looks at them and goes, if you listen to right-wing media, you'd think this moderate market-based framework was a wild-eyed Bolshevik plot to destroy America. Seriously? A Bolshevik plot? They were literally calling their own conservative policy history communism just because a Democrat was the one pushing it. The absolute absurdity of it. Now, this is the most important part of the entire video. Obama looks them dead in the eye and exposes the self-inflicted trap the Republican Party built for itself. He tells them straight up, when you spend 24/7 telling your base that Democrats are dangerous radicals out to destroy the country, what happens when you actually need to sit down and govern? Your own voters think you're a traitor. He nailed it. They poisoned their own base with so much constant fear and rage that compromise became a political sin. They incentivized performance art and outrage over actually helping working-class families get doctor's visits. And while Obama rightly noted that partisan demonization can happen on both sides, he put his finger right on the pulse of the right-wing outrage machine. When you replace actual policy facts with apocalyptic propaganda, real governance dies. Man, Watching that back just reminds me of how much we lose when we let bad faith talking points run the show. Obama showed up with raw facts, policy substance, and actual solutions, while the right wing showed up with cable news buzzwords and got utterly exposed for it. At the end of the day, politics isn't supposed to be about who creates the best outrage for TV clicks. It's about whether everyday people can afford their medicine, keep their homes, and live with dignity. What did you think of Obama putting them on blast like that? Does it feel wild seeing how accurately he predicted the mess we're in today? Drop your thoughts in the comments, smash that like button, and I'll catch you in the next video.